All three operations are very effective. Someone can, with any of the three operations, can lose all of their excess weight and keep it off for the rest of their life if they follow the guidelines. But we're going to talk about that next, as far as what are the guidelines and what do you need to do to be successful. The operations are very effective and they help you to make those changes, but you need to work with it and make some of those lifestyle changes in order to be successful for the long term. Everybody can lose weight short term. You can do that with a diet. So even though the operations have become more effective and safer in recent years, there's still risk to any operation. So unless you're going to get the most out of it, it doesn't make sense to have an operation if you're not going to work with it in order to be as successful as you can. So let's talk about the results of surgery. It's the easiest thing to look at is the weight loss, because we can measure that. You can get on a scale, we can measure that. There's many benefits to weight loss that it's a little more difficult to measure, but weight loss is certainly easy. The weight loss is more predictable with the bypass and the sleeve because we aren't doing those adjustments afterwards, so it's not as dependent on the patient following up. If a patient has a band and doesn't come back and doesn't get the band tightened and therefore doesn't lose weight as much, then there's not much that we can do about that to help them. But when we talk about weight loss and averages, we're talking about everybody. There's more than 100,000 of these operations done every year. So lots of patients that average together what their weight loss is. Like I just mentioned a minute ago, you can lose all of your excess weight and keep it off if you follow the guidelines and work with it. If we look at the average numbers though, with gastric bypass at 1 year, it's about 70 to 75% excess weight loss is what's expected. So if someone's 100 pounds overweight at the time of surgery, at the end of the first year, they should have lost 70 to 75 pounds. That's about the average. 2 years, they tend to keep losing. Long term, which is what we're going to focus on and talk about, because that's the important thing. It's long term. What's for the rest of your life is what we'll talk about. But bypass in the first year, 70 to 75%. The band, because again, there's variability with the patient and following up and getting the adjustment. The band is more around 50%, 45 to 50% in the first year. And then the sleeve is kind of in between the two, like with most other things. The sleeve is in the neighborhood of 60% in the first year. If we go out to the long-term numbers, which is 3, 4, 5 years out from surgery, that's the important number, because at 5 years after surgery, the belief is that if someone has made it to that point at 5 years, whatever lifestyle changes that are necessary, they've made. So what you weigh at 5 years really should be what you weigh at 10 years or 15 years. Somebody, what they weigh after 1 year might go away from those changes and get bad behavior and get bad habits that we'll talk about in just a minute, and they might gain some of the weight back. Everybody's heard of someone who had surgery, gained the weight back, or didn't lose the weight, and we'll talk about why those can happen. It's not the operation typically, it's just somebody following the guidelines that they should to be successful. So at 5 years after surgery, bypass weight loss, average weight loss is expected to be around 70%. Band, around 60%. So not as much difference between the two over time. Sleeve, again, it's kind of in the middle and it's in the neighborhood of 65%. So again, the operations, those are average numbers for everybody. Those numbers certainly can be all excess weight, but those are the averages over hundreds of thousands of people. So let's go on to talk about the medical problems. The medical problems, truly amazing. We're certainly experts in the field. This is what we concentrate on and do every single day. We do bypass, bands, and sleeves every single day. So I can tell you it's amazing from my perspective, from a physician, to see the medical problems go away and to really see what weight does to the body. It truly shows you that the body is not built to hold extra weight. So why it's storing extra calories as weight is very detrimental to itself, much like diabetes or high blood pressure. Something's not functioning correctly. Something's malfunctioning, and that's what's happening with obesity. A lot of that is through the brain and signals to the brain with satiety, but again, there's many reasons for that leads to obesity. As far as the medical problems go, if we look at diabetes, which is really the big problem, medical problem, overall, all comers is about 80% resolution. And when I say resolution, I mean if the weight comes off, then the diabetes goes away. Certainly if somebody gains all the weight back, then the diabetes could come back. So, cure is kind of a word that's not usually used to describe it, because it's resolved if the weight's gone, but if it comes back, then you're susceptible to it. High blood pressure goes away in greater than 90% of people, and that's because it's the obesity causing the high blood pressure. Now, thin people can have high blood pressure too, so if it runs in the family, there's going to be some who have the genetics for high blood pressure, so it's not going to be gone in 100% of people, but 90% gone. Heart function, heart improves greatly because there's not so much resistance and wait for it to pump all the blood through and pump against. So heart definitely improves with weight loss. Arthritis, the weight-bearing joints, the symptoms or the damage that is done is not necessarily going to go away from the bone, but the symptoms of the pain and the weight, for most people, that improves because there's not as much weight. So that's pretty straightforward. Sleep apnea, for most people, it responds quickly. 25 to 30 pounds is pretty significant as far as improving sleep apnea. So most people get off their CPAP machines and whatnot. And then things like acid reflux, high cholesterol, urinary stress incontinence, again, the majority of 90% of people, that goes to normal as well, because again, it's the weight that's causing it. If we can get rid of the weight, then there's no reason for those problems to be there because it's the weight that's causing it. So the weight's gone, the problem's gone.